Hello and welcome back to another great episode of Being Well, a program that strives to bring consciousness and awareness to the world and wants to make a positive contribution to humanity. I'm Marianne and I will be your host. Firstly, in today's show, we will listen to Dr. Skazowski talk about the value and importance of human connectedness and how medical students are dealing with dying patients. After that, it's Cooking with Aliyah, and she will show us a favorite Korean recipe called bibimbap. As usual, we will bring you yoga postures to help you through the day. Today, it is about back pain, so stay tuned for that. Finally, it is again a short film from the Wellcome Trust about sleep apnea. If you don't know what that is, stay tuned and learn more. In the next video, we'll be watching an interview with Dr. Skazowski talk about the medical study that they've made on the reflection of how medical students deal with caring for dying patients. This is very important as it is such a sensitive time for that patient as well as for the family. Let's take a look at this.
Mark, what was the purpose of the study you embarked upon in the 2010-11 school year?
Well, Randy, really we had two purposes. One was to see how the medical students experienced caring for a dying patient. Because after all, they're going from being laypersons like you and I, to doing things like caring for patients and then caring for them at a very serious time in their life when they're dying. And we assumed that that must have a fairly profound impact on the students, and we wanted to hear in their own words what that meant to them. But also, we wanted to see their role models through their eyes. We wanted to see what they thought in terms of what was good practice in caring for a dying patient, particularly in terms of the interpersonal needs, the spiritual needs of those patients and their families. And also hear from them when they saw what they thought wasn't particularly good care of those patients or role models. So we wanted to learn from them about how people could care better for dying patients, and then also to know a little bit about the medical students themselves and their experience.
As background, is that the primary way medical students learn about caring for the dying is through the use of role models?
Yes, well, and medical education in general is very focused on role models. I mean, we have lectures and we talk to them about caring for dying patients, both in terms of their medical needs and then their interpersonal needs. But we do know that that most medical students really do most of their learning on the clinical rotations, seeing what they see from their mentors.
How did you go about assessing what they know and what they've learned?
Well, we asked them to write a reflection. We asked them to talk about a dying patient that they had cared for, and we gave them some prompts to ask them about what they saw that was good patient care, how the needs of the patients and their families were met, and then also what impact it had on their care of patients in the future. And they wrote us short essays on this topic, and then myself and several of my colleagues, that's a multi-authored study, analyzed these essays in terms of themes, and we pulled out particular themes from the essays that we saw repeatedly stated by the students.
And what were those themes? What did you see?
Well, on the patient care side, we learned a few things about their role models. There is some good news that while it's a mixed bag out there in terms of how we're doing caring for patients who are dying, the students reported many good role models. People who were fairly frank and able to break bad news to the patients and their families sensitively, because talking about death is always difficult, but people deserve the truth, deserve some frankness. And we heard that many physicians do quite well at that. They do well at relating to patients, that it didn't have to be a big, heavy thing all the time to care for patients, to talk about heavy themes like death, but that being able to relate to the person interpersonally, to be able to talk about their interests with them, to just show some interest in their humanity each day was very important. We heard that it was very important that physicians offer the use of chaplain services to patients and their families, that we can't expect physicians to be chaplains themselves and care for all the needs of patients, but that in fact just expressing that this service was available opened the door for families to talk about these needs, sometimes to ask the physicians and the medical students to even share a moment of silent prayer with them and those kinds of things. We also heard that there were some negative things about patient care. When you come to a big hospital like Loyola, there's many specialties, many people taking care of the patient. We sometimes say that care is a little bit fragmented in that you can be transferred from different services, surgery to medicine, to other kinds of services. People rotate on and off, the teams come and go over periods of time. And so that fragmentation of care means that if a physician or the team is not inclined to deal with patients' interpersonal or spiritual needs, they can kind of duck it. They could just keep treating the medical problems and somebody else then rotates on. And our medical students told us that that was a very unsatisfying experience for them. That they felt like they were not telling the truth just to the families and patients just because they were going about their business and not addressing the larger picture, and they felt they were cheating those families. Sometimes they expressed that things moved on a little too fast. A student would come in and the patient would have died overnight. And suddenly the patient was gone, the room was scrubbed and cleaned, a new patient was brought in, and they talked about a lack of closure, that this just didn't seem, it seemed inhuman to them to just go on without saying anything about it. However, some teams did pause for a moment of silent prayer or to process any thoughts that the team had. Obviously they can't take very long because they're very busy, but there were some real differences across the way the students reported some teams handled it versus others.
It seems that the first death that a medical student comes upon can be so impressionable. What did some of the students say that they would do differently the next time? What was the lesson learned?
Well, their reflections on what they would do in the future was very interesting. And the key theme that we kept hearing from them as they talked about this, though, was a struggle with desensitization. They felt like they had to hit the perfect amount of desensitization because, dealing with death is so emotional. One student related to us that, he was in an OB unit at the birth of a child, and it was meant to be a joyous moment, and the baby was stillborn. And suddenly, he starts crying. He said uncontrollably, and fortunately his resident took him out of the room and let him express his emotions and was very supportive of him. But he realized that while it's good to be sensitive and relate to people, that just takes the focus completely off the family at that moment who needs them. So they have to become desensitized a certain amount. But to become too desensitized is also problematic because then you fail to connect with the humanity of the patient and the family. You can ignore or miss cues about their spiritual needs or their needs to relate to them. And so that was the main theme we kept hearing from the student side, was about this desensitization. And as they battled that, some committed to ongoing reflection, to always reflecting on the death of a patient after the patient dies, because that's a unique individual and they don't want to become so desensitized they forget that and just move on, as I was talking about earlier.
Well, what are the implications of your research for medical education and bigger picture patient care in the future?
Oh, and we're just starting to unpack that. There's some low-hanging fruit, it seems, that we can think about. For instance, from this paper, we've started to think about instituting a spiritual timeout for a team. That when a patient dies, you simply call a timeout for a couple of minutes, and the team gathers and just is asked for a moment of silence, or if anybody would like to say anything. And at least there's some acknowledgement of that, and so perhaps that can help preserve some of this, help us hit that appropriate sensitization mark. But beyond that, it's trickier. How can we help people reinforce the good messages and eliminate the bad ones? Perhaps recognizing good role models would be helpful to us. Some students as we talked about that fragmentation of care. Some students reported that they had attendings who would have them follow a patient who was dying once they moved on to another service, even though the patient's no longer on their service, have the med student go see how they're doing and report back so that everybody on the team gets the picture of what's happening to that patient. Perhaps when people reach across the fragmentation of care like that, we should recognize them. We should, they should get an award or be recognized that month as an outstanding clinician. So we have to keep finding creative ways to reinforce these good messages for the future.
Well, is there anything else you would like to add? Do you think this essay project will be continued?
I think so. I think that we have to Also look at how other healthcare professionals view it besides med students. For instance, we did learn that our nurses are tremendous teachers of our med students during this period, and yet we really are always focused on the physician side. Yet our med students were reporting that it was the nurses who were bringing them up and helping them care for the patient's body after the patient died, and reinforcing some really important lessons. So extending the project to other professions is really important. But then again, looking just at creative interventions and assessing those interventions. We only want to do things if they're effective. We don't want to put things into place and then and not be sure that in fact they actually helped the situation.
Thank you for sharing what you learned.
Thank you, Randy.
Now it is time for Cooking with Aliyah. She's going to show us how to make a favorite Korean dish called bibimbap with a Moroccan twist. Watch this.
Hi, this is Aliyah and welcome back to a new episode of Cooking with Aliyah Gangnam Style. Today we're in my kitchen because we're going to cook, and we're going to cook one of my favorite Korean dishes called bibimbap. Bibim means mix, pap means rice. So basically it's a mixed rice dish where you have a bowl of rice with the different types of vegetables around and some kind of protein like beef or chicken or egg for a vegetarian option. And today we're going to make it my way because we're going to make Korean bibimbap with a Moroccan twist. So let's start! First, we're going to prepare all our ingredients little by little. So there's some kind of preparation, but don't worry, it's very easy. Here I have a carrot, so just peel your carrot. Nothing hard so far. So quarter the carrot and then cut it in a julienne style. So just thinly slice it. If the carrot is big, slice it again so you have thinner sticks like that. Now we're going to do the same thing for the zucchini. So have a zucchini here, cut the bottom and the tip, and then cut it in half, quarter it, and thinly slice it. You can keep them like this or just put them together and cut them in half again. We're also going to use mushrooms. I'm using some sort of trumpet mushrooms. You can use shiitake mushrooms or regular white mushrooms. And again, we're going to thinly slice them. We're not done with the vegetables yet. I have a fresh spinach and I have bean sprout. So as you can see, this is really healthy. Pick the vegetables you like. And now I'm going to show you how to cook them. It's super easy. For the spinach, boil some water in a saucepan and then just put the spinach in for like around 1 minute. After 1 minute, remove the spinach from the boiling water and put it in cold water that also has ice. See, I have an ice cube here. That will make the spinach stay green and crisp, and we want that. So keep it here for 2 minutes and then we're going to remove it. While the spinach is cooling down, add a pinch of salt, a large pinch of salt in the boiling water, and add the bean sprouts to it. So we're going to boil them for around 15 minutes. Back to the spinach, just take it from the cold water and give it a good squeeze. And that's it. It's ready. I'm going to saute the zucchini, carrot, and mushroom using the Moroccan charmoula spices, and that's the Moroccan twist. Here I have some cumin, paprika, hot chili pepper, spicy, and some salt, and a little bit of crushed garlic. And we're going to do this with olive oil. Super easy. So first, mix all the spices here. So you just have to add a pinch of this mixture. In a flat pan, drizzle a little bit of olive oil, add a little bit of crushed garlic, and a little bit of our spice mixture. This is to heat up the spices so all the flavors come out. And now we're going to saute the vegetables separately. So first I'm going to start with the zucchini. And I'm just going to saute it for like 45 seconds. Okay, remove the zucchini, put it in a plate. And we're going to do the same thing for the carrots. So a little bit of olive oil, garlic, a little bit of spices, mix, and add the carrots. And we're going to just saute them for like a minute. Remove the carrots. Here, oh, all crispy. And again, we're going to do the same thing for the mushroom. Saute them again for like 1 minute. It should be fine. For my protein, I'm using shrimp. So I just cleaned a little bit the pan. I put olive oil and my peeled fresh shrimp. Here I'm going to use a little bit of lemon juice, like a fresh squeeze. And I'll just mix them. I'm not going to add the charmoula spices on the shrimp because I think the other vegetables are already flavorful. So just a little bit of salt and a little bit of pepper. So here's my pepper. And that's it. Then the dish will get the charmoula spices from the vegetables. Shrimp cook pretty fast, so as soon as it turns like opaque and pink, it's ready. So remove it from the juices and just keep the shrimp. One more thing for the spinach, just give it a little chop. You don't want these, they're too hard to eat, but chop the rest. As you can see, it's a very easy recipe, and here I have all my ingredients and they're all super healthy. And now I'm going to show you how to put the bibimbap together. First, we're going to put cooked rice here. So for cooked rice, I mean, you can use any kind of rice you want, white rice, brown rice. You can use a rice cooker, or it's 1 cup of rice, 2 cups of water, a little bit of salt, a little bit of olive oil. You close it and you cook it for 20 minutes, it'll be fine. Now I'm going to display the vegetables nicely around the rice. So first I'll put some carrots here, some zucchini, some bean sprouts, and of course remove them from the water once they finish boiling. I have the mushrooms also, yum. You can see all these beautiful colors and different textures. I love this dish. We have the spinach here, a little bit of green. And finally the protein, and you put the protein in the center. And to finish the Moroccan touch, I'm going to sprinkle it with a little bit of fresh chopped cilantro. Yum! It'll give a little bit of color, and cilantro just works with charmoula spices. So this is perfect. And that's it. Here's my bibimbap with a Moroccan twist. You can serve it hot or cold, so you can prepare the vegetables beforehand and just serve them at the end, or right after you cook them like I showed you. Also, be careful with the salt. There are a couple of things that I didn't salt, like the spinach and the bean sprouts. It's because I added a little extra salt in the shrimp, so I know when you mix it up, all the flavors will be mixed together. So the spices, you have to be careful about that when you're using different types of vegetables and different times of cooking. And that's it. Look how pretty it is. And now we're going to mix it and taste it. Just mix all the stuff here together with the rice. Yummy. So the thing is, in Korea, they serve it with Korean hot sauce, which is like a red hot sauce, red pepper hot sauce. It's too spicy for me sometimes, so I like it like this. However, you can replace the Korean hot sauce with harissa. Yes, it would be perfect. Now that's real fusion. So you mix, 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 using chopsticks here. And you just taste. Yum. Take a little spinach with a little here. Wow. I can feel Korea and Morocco both crunching out in my mouth. Yum. It's delicious. I love fusion dishes. I hope you enjoy it, and bon appetit. See you next time.
Hello and welcome back. Now it's time for yoga. Today, yoga instructor Jen Hillman is going to show us a yoga routine that is great for relieving back pain. This is good especially for people who has upper or lower back pain and someone who sits by a desk the entire day. So grab your yoga mat and let's do some yoga.
I'm Jen Hillman. I'm a yoga teacher in Austin, Texas. And today I'm going to demonstrate some stretches that you can follow along with. We'll be doing some stretches to open up tension through the upper and lower back, as well as through the sides of the body. So these are some really nice stretches for anyone that is experiencing upper or lower back pain. It's good for anyone who spends a lot of time at a desk or sitting for their job. So these are just some nice ways to open up the compression and tightness that happens in the back. So the first pose we're going to start with is on the knees. And you'll just start by placing your head down on the floor in front of your knees, placing the crown of your head down. Then you'll reach behind you and grab onto the heels. From here, you'll start to lift the hips up and round the back. And this allows for a nice stretch through the tops of the shoulders and the top of the back. You can come down for a moment to rest. And then coming up again, lifting the hips. And folding back down. Then we'll come up into a seated position. And we'll start with the right leg, crossing the right leg to the outside of the left knee. And then reaching up high with the left arm, you'll hook the left elbow to the outside of the right knee and twist towards that right leg. And this twisting action allows for more mobility through the middle back as well as into the low back. And if you include your head with this twist, then you're also improving the mobility in the neck through the cervical spine. And as you untwist, you can bring that right leg out to the side while keeping the left leg bent in. And just reach the left arm up and over towards the right toes. And then rotating the left shoulder down towards the floor, you can start to deepen the stretch through the low back on the left side. So coming up, we can switch to the other side. You can just fold in that right knee and bring the left foot to the outside of the right knee. And then reach the right arm to the outside and twist. And then extend the left leg out to the side. You'll start to bring the right arm up and over, reaching towards the left toes. And then rotate the right shoulder down towards the floor. And we'll come back up to seated and just let yourself relax and rest. And today I'm going to take you through a sequence of balancing postures that you can follow along with. So why do we practice balance? Balancing is really important because it helps you to gather your center and gather your focus. A lot of times when we're moving through a workout or other yoga sequences, we're moving so fast and rapidly working through each of the poses. But balancing presents a new challenge where you have to really develop your strength and your sustainability so that you can maintain these balancing postures. So, for an added challenge here, I encourage you to try this sequence without putting your foot down, moving gracefully and easily through each of the balancing postures that I'm going to show you. You can follow along with this video, so go ahead and favorite it so you can try it lots of times and see your balance and posture improve. So we're going to begin in a simple balancing posture that is the tree pose. There are lots of different arm variations that you can use, but today, just for this sequence, we'll be using the hands in a prayer mudra at the heart center. So we'll begin by shifting the weight onto the right foot, lifting the left knee. We'll begin placing the left foot to the inside of the right thigh. If you don't have the flexibility here, you can place your foot at the calf. You can go below the knee or above the knee, but not balancing at the knee. You don't want to put that side pressure on the side of your knee. So just find where your limit is, and bringing the hands to heart center. You can find one focal point. This is called a drishti. So find one point to focus your gaze that's not moving. And this can help you to feel grounded and more stable in your balancing pose. From here, we'll begin to move into the next sequence, the next posture, which is the warrior 3 position. So I'm just going to turn on my mat so you can see. But for this added challenge, you just keep that left foot up in the air. So bring that left knee up in front of you, squeezing through the abdominals, lifting through the quadriceps and the hip flexors. From here, begin to shoot that left leg out behind you as you tip your torso forward. And the goal here is to create a horizontal line with your body. So you want to work on turning that left hip down towards the floor, keeping your pelvis level, and engaging through the core so your belly doesn't drop down. We'll begin to come back upright, tucking that left knee up in front of you. We're going to move into what's called a dancer pose. So you can start to bring that left heel in towards the hip. Turn your left hand out like you're serving a tray, and hook the hand to the inside of the left foot. Lift the right arm up, stretching up to the sky, and begin to kick back with the left leg. So you're also stretching through the chest and opening the left shoulder. Coming back up through center. Again, squeeze the left knee up in front of you. And for one final challenge, kick that left leg out in front. Really power through the foot, flexing hard through the foot, lifting up tall, and then lower the foot down. And then we'll move on to the other side. So shifting the weight into the left foot, you begin to bring the right foot up for this tree pose, bringing the foot to the inner part of the left leg, if it's on your calf or on your thigh. And as you're ready, start to squeeze that right knee up. We're going to move into the warrior position. So with the right knee lifted high, balanced on the left leg, we'll start to shoot the right leg out behind you, tilting the torso forward. You're working that right hip down towards the floor, lifting through the core, and extending powerfully through the right leg. Coming back up, draw the right knee in tight. And we'll move into the dancer pose. So you bring the right heel towards the hip, open out the right hand, hook the hand to the inside of the right foot. Lifting the left arm up high, you'll start to kick back with the right leg, opening the right shoulder, and naturally your torso comes forward. releasing the leg. Final challenge. Drawing the right knee up and in, engaging through the abdominals. Start to kick the right leg forward. Pressing through the right foot, engaging through the quads, lifting up high through the chest, and then lower the leg down to meet the left. So this is a pretty challenging sequence of balances, but as you practice, you'll be amazed at how quickly you can improve your balance and improve your posture and improve your focus and balance throughout your life. So a lot of times, tension in these areas can contribute to sciatic pain and are just generally tight for people that sit a lot or spend a lot of time driving. So these are some really great stretches that you can follow along. They're pretty simple to do and will really help to open up those tight and compressed muscles. You can also check out my previous video with some other stretches for sciatic pain, and all of these stretches are great in conjunction with each other. So today, to get started, we'll start in a seated position. And you'll tuck one leg in and bring your other leg across parallel to your chest. So you have one knee coming in towards your shoulder and the foot coming in towards the opposite shoulder. And here you'll just hug the knee and the leg in tight. You'll start feeling a nice stretch across the back of the hip. And just take some nice deep breaths here. You can roll around if you need to explore the space. Find that sweet spot where you can really get a nice good stretch. From there, we'll start to just extend the legs straight out in front of you. This will start to stretch into the hamstrings. And as you press through the knee, then you'll also start to get a nice stretch at the attachments at the back of the knee. You can also pull the toes towards your face to deepen the stretch through the calf muscles as well. And from here, you reach across the foot with the opposite hand and start to draw the leg across the body. This is going to take the stretch directly into that iliotibial tract, the IT band. It's usually pretty nice and tight for most people, so you're likely to be experiencing a lot of sensation here. This is a good time to breathe. As you release, you can plant your foot in front of you. And then sit up on your knee, so you're in a kneeling position. And then draw your foot across to the opposite side of the body and straighten out the knee. And from here, just begin to fold over the leg. So this is the same idea as a moment ago. We're going directly into the iliotibial tract as we stretch, forward folding over the leg. And finally, you can bend your knee and bring it down to the floor in front of you so that your shin is parallel with the front edge of the mat. And extending the leg behind you so that it's coming straight out from your hip. This is a great stretch to get into the hip and into the piriformis and all through the 6 deep rotators in the glutes. And once you find yourself in this position, you can start to fold forward to deepen the stretch. Coming back up, you can shift your weight onto your hip and bring the back leg around to the front. And now we're ready to move on to the other side. So you'll bring the foot up towards the shoulder, cradle the leg like you're holding a little baby, and squeeze the leg in tight, and start to access those deep hip muscles. And always continue breathing and let your breath help you to relax into these stretches. So when you come into those places where it feels tight, your breath is an excellent way to help you relax and soften into the stretch. And then extend the legs straight out in front. Feeling a nice deep stretch in the hamstrings. Pulling the toes toward you to access the calf muscles as well. And then drawing the leg across the body, we start to get into the IT band. You can also start to twist toward the leg. And that will give you a little more stretch, a little more sensation. And then dropping the foot down to the mat, you come into that kneeling position. And again, bringing the foot across the body, extend through the knee, and start to fold forward. And you may notice one side is more tight than the other. For me, it's definitely the left. So just take a moment to breathe here. And again, remember to relax and soften into the stretch. And as you feel ready to come out of it, you'll bend the knee and bring the shin down parallel to the front edge of the mat. And work the back leg out behind you. And when you find yourself relaxed into this stretch, you can start to fold forward again, getting nice and deep into those rotators into the glutes and hips. And to come out and just start to sit back up. Shift your weight onto your hip and swing the back leg around. So these are just a few simple stretches that you can practice on your own that will help to release that tightness through the IT band and through the hips and glutes. So go ahead and favorite this video so you can come back and watch it again and practice these stretches anytime that you're feeling that tension creeping in. And leave me a comment and let me know how these stretches are working for you. Let me know how it's going. You can also visit my website, jenhillmantherapeutictouch.com, to learn more about me and my practice. And don't forget to subscribe to the Psyche Truth channel, so you have access to my full library of videos. Thanks for watching.
Hello and welcome back. Obstructive sleep apnea is when a person stops breathing when they are sleeping. Not only is this dangerous, but this also reduces the quality of their life. In the next short film by the Wellcome Trust, we will get to have a better understanding of exactly what obstructive sleep apnea is.
We work with patients who have obstructive sleep apnea, and obstructive sleep apnea is the inability to breathe when you go to sleep. It is what it says on the tin. It's obstructive because your airway blocks off, and it occurs during sleep. And then the word apnea means cessation of airflow. We're interested in both how sleep apnea occurs, but also the consequences of that. So we're interested in what happens to the cardiovascular system and also memory and cognitive function with people who have difficulty in breathing during sleep.
First, I found that it was more difficult to concentrate on work, more difficult to make the effort to get in and out of work because I had a substantial commute to London and back. Secondly, my social life was shot to pieces in that all I wanted to do when I was at home was to sleep. And then I had unrefreshing sleep. I found I woke in the morning with usually a headache and feeling zombified, frankly. And thirdly, it affected my driving, as I found to my cost when I fell asleep on the M6, and was very lucky indeed to avoid a major or fatal accident.
If you're trying to get air into the lungs, how you do that is you create a negative pressure here in the lungs by increasing your rib cage, and that causes air to be drawn in through the airway. If this airway is then relaxed because you're asleep, what can happen is that as you suck down the negative pressure here, this part of the airway gets sucked closed. And particularly that can happen if you've got a narrow airway, because your jaw here is a little bit more set back than it otherwise would be. And also if you've got a lot of fat tissue around the neck and around the airway, then that can also make the airway narrower, so that when you then try to breathe in, this narrow airway is more likely to collapse.
I had a sleep study which involved simply sleeping with an oximeter on your finger and some other recording kit overnight, and at the end of that they could tell that I had sleep apnea, and that in fact I'd been waking several hundred times a night. I think my score was somewhere about 400, which meant that in fact I was getting no proper sleep at all.
So this is Jen, who's a medical student, and she's modelling our sleep equipment for us. And what she's got on here is she's got some electrodes on her head and in her hair, which are measuring her brain activity, and they will measure how many times she wakes up during the night and she arouses. She's also got a little cannula underneath her nose, which is measuring her airflow. And she's got 2 bands around her chest, which are measuring how much she breathes in and out. So if she stops breathing, these bands will keep moving because she'll be trying to breathe, but we'll find no airflow from this signal here. So this is Jen's activity. Here she is laying here. This is an infrared camera, and we can watch her during the night. And what we can see with her brain activity is that it's very low voltage and it's quite fast, and that shows us that she is awake during this period that we're recording her. Although funnily, I don't know if you can notice here that the wave signals are a little bit slower compared to here, and that's because she's starting to fall asleep at this point here. So she's obviously quite relaxed. So what I'm going to show you now is some data from a healthy volunteer who volunteered for one of our studies, and he turned out to have some irregularities in his breathing. He's got obstructive sleep apnea. At this point here you can see there's no airflow, but he's still trying to breathe. But because there's no airflow, his oxygen saturation's falling, and at this point here he wakes up again. And so he wakes up, and you can see there's noise on the microphone as he clears his airway and sort of goes and wakes up from sleep. And he gets some very nice big deep breaths here, which allow him to reoxygenate his blood. And there's a little bit of a lag on the oximeter, but you can see the oxygen rate going back up here to 97, whereas here it dropped down to 89 when he wasn't breathing. And also when he wakes up, you can see his heart rate gets faster. And if we had a measure of his blood pressure would go up at this point as well. Older people have less of an increase in blood pressure, and the increase in blood pressure is slightly slower. And the 2 things that we know about patients that have sleep apnea is, one, they have an increased cardiovascular risk because of these increases in blood pressure, and the other one is that they are sleepy because they have these arousals from sleep. But what we don't know is how aging influences that sleepiness and these increases in blood pressure. And sometimes older people don't necessarily complain of their sleepiness, maybe because they don't have to get up for work and they're able to have a little nap during the day. And also it may be that they have less of a cardiovascular risk because of this lower increase in blood pressure. But then the other side of that is that they might have a higher cardiovascular risk because they're older and they're more likely to have cardiovascular events. So normally we would treat sleep apnea with something called continuous positive airway pressure. In short term, hand term, it's called CPAP.
Simply put the mask in place, fit the headgear on, and this is all made of some sort of stretchy material, so it's not too bad. It doesn't have to be too tight. And then you switch the machine on, like so. Just take a minute or two to come up to pressure. It's now up to pressure fully.
What CPAP does is it blows air into the back of the throat here, so the patients sleep with a little mask on, and the airflow comes down the back of the throat and it splints the airway open and stops it collapsing when the patients breathe in.
I had my first night with a CPAP machine in a hospital bed where you tend not to sleep very well. I slept amazingly well, and in the morning I felt that everything was quite extraordinary. My body was recovering very quickly from years of sleep deprivation, and within 2 or 3 days I think I was totally back to normal. But it just took that time. Other people are not quite so lucky. They find it takes a week, 2 weeks, perhaps 4 weeks to get back in, and that's difficult if they're getting used to the machine, because they're not getting immediate benefit from the machine, and they're having to get used to what is quite an arduous therapy at the same time.
What we don't know is with older people, is it worth them sleeping with this mask on their face? Do they get good symptom relief? And because of the number of older people that have sleep apnea, we also don't know from a health economic point of view, is it worth treating older people with sleep apnea? Do they, economically, does it make sense to alleviate their cardiovascular risk and help their quality of life? Or is it just providing extra burden on these older people? And so recently we've been funded by the National Institute of Health Research to carry out a multi-centre randomised trial looking at the treatment of sleep apnea in older people. This is the first multi-centre randomised trial that's ever been carried out in this country that's been funded by the National Institute of Health Research, and it's partnered between Imperial College, Edinburgh University and Oxford University. There are some key issues about this grant that are really important for me. One is that it's translational research. So we started off doing our physiological studies funded by the Wellcome Trust, and what we've been able to do is take the findings that we've got from those studies, and now we're actually in the position where we can translate that into something that may well make a difference with patient care. The other thing is that this is the first time that we've built up a sleep network in this country. So this is a big grant in terms of sleep research, and it's the first time that we've been able to do that in this country, which is very exciting for me.
So we've come to the end of today's show. Thank you so much for watching, and I'll see you in the next episode. Remember to follow your bliss and live your passions. Take care and be well.